Minister, I want to talk to you, want to ask you about the COVID crisis and the question of mental health. There was a recent article in the Irish Times entitled "Ireland Facing a Tsunami of Mental Health Problems." This article cited international evidence to show that the pandemic has served to intensify the mental health crisis in other countries. For example, in the United States, 45% of people with suicidal thoughts recently had explicitly linked them to COVID-19. Now, Maynooth University and the Centre for Global Health in Trinity College Dublin recently released the first wave of the Irish COVID-19 psychological study. The survey found 41% reporting feelings of loneliness, 23% with clinically meaningful levels of depression, 20% with clinically meaningful levels of anxiety, and 18% with clinically meaningful levels of post-traumatic stress disorder. An article recently in the Irish News estimated that Ireland would be among the top 20 countries in the world most likely to experience a surge in mental health cases as a result of the pandemic. Now, all of this comes on top of a situation where mental health services are already creaking at the joints from the pressures of demand in the context of underfunding. For example, the CAM service, 2,200 on the waiting lists, according to the last figures we have in 2019. In my own area in Cork Kerry, 162 people waiting for those services for a year or even more. Are our mental health services fit for purpose? I don't mean in any way to question the work of the staff, paid staff and volunteers who do heroic work, but even heroic work doesn't necessarily cut it when a mere 6% of the public health budget goes on mental health services, as opposed to many European countries which would be spending a percentage at least double or more of that. The result? A huge over-reliance on the voluntary and charity sector, a sector which is uniquely exposed to this crisis. For example, the way in which fundraising has been cut across. We saw what happened with Darkness into Light. Charities are expecting to lose income by up to 40% this year. 54% of charities are concerned that their charity may be unable to continue providing services for more than 6 months. So I put it to you, Minister, that what we have here is a real double whammy. On the one hand, underfunded services, creaking at the seams already before COVID, and now hit with a funding crisis. And then on the other hand, what that article described, a tsunami of mental health problems. What does it add up to? It adds up to a really, really difficult situation, and I think a situation which cries out for urgent action by the state. I would argue two things in particular: that there is a need for an immediate doubling of the state's mental health spend as a first step. And second of all, I think this points towards the need for the establishment of an Irish National Health Service, where the voluntary and charitable sector are integrated within fully a public health services. So I'd like to ask you two questions. Number one, to comment on the mental health crisis that we're facing as we move out of lockdown. And second of all, your position on the two issues that I've raised about radical increases in spending and the need for public health service to cover the mental health area.
Thank you, Deputy Minister.
Well, thank Deputy Barry for raising this very important issue, and I do want to say at the outset, because I'm conscious people watching in on this, like all of us, could be experiencing mental health challenges. So there is support available, and there's a yourmentalhealth.ie, a very useful website that can direct people to those supports. So I would encourage anybody in need of support to obviously reach out. I think the Deputy is really right to highlight this. I think we're going to have a very serious mental health challenge emerging from this crisis. We've had people lose so much certainty in their lives, so much that they hope for the future has now been cast in doubt, at least temporarily. And that's why I took the decision, the unusual decision during an interregnum last week, to ask government for permission to publish the new Vision for Change called Sharing the Vision, our new 10-year mental health policy. You'd usually wait for a new government all of you in this House said, no, get on with it, publish it. It'll be formally launched by Minister Jim Daly tomorrow. Key to that, though, and this is my advice to the next government, my advice to the Oireachtas, key to that is going to have to be the implementation structure. That's where the last Vision for Change document fell down. An implementation structure, and possibly, respectfully, an Oireachtas Mental Health Committee. So I agree, there's a real challenge in relation to this. Next week we'll be launching a crisis text line, Ireland's first ever 24/7 crisis text line, particularly aimed at younger people with mental health. And I know I'm out of time on this, but I do want to say we have provided some additional funding. You've seen the additional funding to Beata House, €114,000 more a month to provide 300 additional counselling hours a month for high-risk clients as well, and some funding for extra online supports. But it's about more than that. It is going to be about how we deal with a whole of society mental health challenge arising from the COVID pandemic, and I don't disagree with much of what the Deputy said.
Thank you.